First, I would like to thank the organizing committee and for kindly inviting me to deliver the talk, and also thank Dr. Gong for the introduction. So today my topic will be potential of halofuginone for treating cardiometabolic disease. As we all know, obesity has become a global pandemic with rising prevalence in both developing and developed countries. And according to a latest statistics report from the World Obesity Atlas in 2025, so by 2030, so more than half of the adult men and women will be living with high BMI. So obesity will be a very pressing issue. And obesity is not a single disease. Actually, it constitutes a major risk factor for multiple life-threatening disease, including the fatty liver disease as well as cardiovascular disease. So as we can see from these slides, so when the obesity affects the liver, it can cause in the nephro, now it's called the method of MASH, and in the heart, it can accelerate coronary heart disease. And according to a recent report from the JCC, so global drivers of changes in the cardiovascular disease daily, which is called the global disability life adjustment life year. So metabolic risk as well as the lifestyle behavior risk constitute the major part of the drivers of the CVD associated daily. So here I'd like to borrow a slide from Dr. Xiaoyong Yang from Yale. So our energy balance is finely determined by the fine balance between the energy intake as well as energy expenditure. If we restrict our food intake as well as restrict the absorption, we can reduce the energy intake. In addition, if we increase physical exercise and adaptive thermogenesis can increase energy expenditure. There are several different strategies to manage obesity. So first is lifestyle intervention. So this includes the nutrition, exercise, and behavior intervention. And second will be the bariatric surgery, and thirdly some drugs. So currently there are several emerging new drug targets for treating obesity and its associated metabolic disorders. And this includes the GLP-1 receptor and GD15, FG21, and actin receptor 2. And the agents that can elevate GLP-1 and GD15, FG21, and inhibit actin receptor 2 can monotherapy and as a combination therapy hold great potential for treatment with obesity. And these kind of agents are in the clinical stage at the different levels of the clinical trial. And also some of the agents, they can act in synergism by using the dual therapy and the triple therapy. However, these protein and antibody-based therapies for obesity have some hurdles, including the stability issues and the short half-life, and is associated with high cost and some side effects and adherence issues. Therefore, there is a pressing need to identify very safe and tolerable therapeutics for obesity. So we are quite interested in some natural product-derived anti-obesity agents. Now here we are interested in one biotic compound derived derivative called halofuginone, which derives from the traditional Chinese medicine called changshan. And fibrofugin is the one compound derived from the changshan, and halofuginone is a derivative of fibrofugin. So in the Shenlong Herbal Classic, Shenlong Benchao Jing, changshan has been used to treat malaria. And halofuginone is a halogenated derivative of fibrofugin, and it has been approved by US FDA as an antiprotontal drug, and it can mimic amino acid starvation. So currently there is ongoing clinical trials of halofuginone in treating HIV-associated Kaposi sarcoma as well as advanced solid tumors. And there is no reports regarding the role of halofuginone in treating metabolic disorders. And pharmacologically, halofuginone can directly bind and inhibit EPS1. The full name of EPS1 is called glutamyl polonyl tRNA synthesis, thereby causing the accumulation of the uncharged tRNA, thereby mimicking the amino acid response, inhibiting the Th17 cell differentiation. So previous studies have reported the halofuginone have multiple pleiotropic effects, including anti-malaria, anti-immune modulatory, as well as attenuation of the different types of fibrosis in different organs, including the heart, liver as well. And so on the left, halofuginone, it can mimic amino acid deprivation, thereby activating the GCN2, ER2 alpha, and ATF4 dependent integrated stress response pathway, thereby leading to the upregulation of the genes related to counterbalance the amino acid deprivation. It also can reduce the protein secretion, the translation. So here we asked a straightforward question. whether pharmacological mimic of amino acid starvation by halofuginone can treat obesity. So first, we approach this question in the diet-induced obese mice. We performed our dose escalation study by using 3 different doses from the 25 to 100 microgram per kilogram, and we used the GLP-1 receptor agonist liraglutide as our reference drug. So as you can see from the graph, so halofuginone treatments, especially the high dose of halofuginone, can lower the body weight gain very significantly and even stronger than the GLP-1 agonist liraglutide. And it also reduced the fat mass percentage and had no significant effect on the lean mass percentage. Next, we look at the role of halofuginone on the serum lipid biomarkers, including the serum TG and TC. And we find that halofuginone, especially the high dose of halofuginone, can lower the serum triglyceride levels, TC levels, and AST, ALT levels without affecting urea and the chorea levels, suggesting that halofuginone can lower lipids as well as reducing biomarkers associated with liver injury. Next, we switch to the metabolic tissues, morphology, histology. And first, let's look at the white adipose tissue. So we can see that halofuginone treatment, the adipocyte area was reduced by halofuginone. And this is the quantification in the underneath. And if we as we all know, the liver is the affected organ of obesity. So next, we tested the effect of halofuginone on the liver histology and the signaling pathways, and we find that halofuginone treatment can lower the body weight, as well as the hepatic steatosis induced by high-fat feeding was attenuated by halofuginone. And the liver TC, TG levels, and we find that the liver triglyceride levels was significantly affected by halofuginone. However, the TC level was not significantly affected. And previously, our animal model using the male animal model. So here we use another animal model, which is the OBV mice, a genetic model of obesity. And in this animal model, we also recapitulate the anti-obesity effect of halofuginone. And in the female mice fed with high-fat diet, we also find in this female model of obesity, the halofuginone treatment can also lower the weight gain in this model. Next, we want to assess what kind of the downstream mechanism might be involved. So first, we addressed the effect of halofuginone on food intake and energy expenditure. So as you can appreciate that halofuginone treatment can reduce the food intake either by the random food intake as well as the metabolic cage food intake. And we also use the pair feeding to correct the effect of the food intake suppression. And interestingly, we find that pair feeding doesn't fully recapitulate the effect of halofuginone, suggesting that halofuginone may exert some other additional mechanisms beyond food intake suppression. And the halofuginone treated mice also did a better job in the cold tolerance test, and in the brown adipose tissue, it can increase the UCP1 protein expression as well, suggesting it can increase the thermogenesis, and in the energy expenditure, so it can increase the energy expenditure either in the daytime and the nighttime. Next, we want to tease out the mechanism involved in halofuginone, and then we collected the tissues, especially the white adipose tissue as well as liver tissues from the mice treated with halofuginone, and we performed the RNA sequencing analysis in these two metabolic organs. And interestingly, we find that the GCN2 ATF4 integrated stress response pathway was enriched in the differentially expressed genes. And interestingly, among the upregulated genes, we find FG21 and GD15 as two very important hallmark the therapeutic target in obesity as well as metabolic disorders were upregulated by halofuginone treatments. So we hypothesize that the upregulation of both cytokine may contribute to halofuginone-mediated and obesity effects. Next, in the diet-induced obesity mice, we find that halofuginone can increase ATF4 protein expression as well as serum secretion of GD15 and FGF21 without affecting the level of the leptin as well as adiponectin. Because the GD15 has many different responsive tissue and organs, including the liver as well as the kidney and intestine as white adipose tissues. So we find that in the liver, it is the most responsive and sensitive tissue and organ that responds to halofuginone treatment in terms of GD15 upregulation as well as the FG21 upregulation. So next, we performed studies in the cultured hepatocytes. We find halofuginone treatments can activate the GCN2 ATF4 pathway, and after supplementation of the proline, can reverse the effect of halofuginone on the GCN2 ATF4 pathway. And this was also true in the expression of the ATF4 and the GDF15 F21 gene expression when we treated the hepatocyte with the GCN2 inhibitor as well as the ATF4 siRNA, suggesting that the GCN2 ATF4 pathway was involved in the GDF15 F21 elevation. Halofuginone. Next, we approach the effect of halofuginone in vivo. So we dose the mice with the halofuginone as in concurrent with the inhibitor of the integrated stress response, which is called as ISRB. And we find that ISRB treatments can reverse the effect of halofuginone on the GD15 and F21 gene expression as well as the protein secretion. So indicating that this also happens in vivo. And next, we use the different animal models, in particular the GD15 knockout mice and the FGF21 knockout mice, to elucidate whether both cytokines are really responsible for halofuginone-mediated actions. So first, we generated the GD15 knockout mice, and we find that GD15 depletion actually can partially reverse the effect of the halofuginone-induced weight loss. Because the GDF15 is a well-known metabolic that is responsible for food intake suppression. So after knocking out of GDF15, we find that the effect of halofuginone on food intake suppression was abolished, suggesting that GDF15 mediates the effect of halofuginone on food intake. However, the effect of halofuginone on energy expenditure remain intact, suggesting additional mechanisms or targets might be involved. And in brown adipose tissues, we find that halofuginone-induced UCP1 upregulation remain intact in the presence of the GDF knockout, suggesting other molecules may be regulating the UCP1 upregulation. Next, we approached whether hepatocyte-derived FG21 is responsible for halofuginone-induced metabolic, especially their energy expenditure. So we generate hepatocyte-specific knockout GDF15 F21 knockout mice, and we find that F21 was almost depleted in the knockout mice, suggesting that the liver is the major secreting organ or tissue of F21, and the halofuginone-induced upregulation of F21 was partially reversed by the F21 hepatocyte deficiency, suggesting hepatocyte F21 contributes to the effect of F21. And using the knockout mice, we also find that hepatocyte-specific knockout FG21 also partially reversed the effect of halofuginone on the food intake, on the body weight loss, suggesting that FG21 from hepatocyte is responsible partially for the weight loss effect of halofuginone. And next, we performed the energy expenditure analysis in the metabolic cages. We find that the food intake suppression effect of halofuginone was not effective. And we find that the energy expenditure effect of halofuginone was totally abolished in the hepatocyte F21 knockout mice. And this is also the same when we find that the FG21 knockout mice, the effect of halofuginone on the UCP1 upregulation was totally abolished. So the above data, we came to a summarize of the previous data, and we find that halofuginone, it can activate the GCN2 EI2 alpha ATF4 integrated stress response pathway, leading to the upregulation of downstream targets, including the GD15 as well as F21. And on the one hand, the GD15 can lead to the food intake suppression. On the other hand, FG21 can lead to increased energy expenditure. It's just like a scale to keep the balance of our metabolic homeostasis. So next, we want to ask the question whether halofuginone can exert therapeutic effects on the muscle and mesh, because the metabolic liver disease is affecting almost 1/4 of the world adult population. So we first examine this possibility in the mesh animal model, which is treated with the high-fat, high-fructose diet. And we find that in this mesh animal model also has some obesity phenotype, and we find that halofuginone treatment, especially the highest concentration of halofuginone, has the very strong potency in lower the body weight, and it is much stronger compared with the reference drug liraglutide. And the high dose of halofuginone, the effect is very close to our control mice. And what's happening in the liver? So we examine the histology changes in the liver, and we find that halofuginone at a different dosage can attenuate the liver steatosis in a dose-dependent manner. And the high concentration, high dosage of halofuginone, the effect is very close to the liraglutide. And it is also true in the picrocerebus red staining, which is an indicator of the liver fibrosis. And we find that halofuginone also can lower the liver weight as well as the liver triglyceride levels without significantly affect the liver TC level, suggesting that in the MASH models, halofuginone can treat the MASH. And this is also true when we examine the serum ALT level and AST level, which are indicators for the liver injury. And we find halofuginone treatment can dose-dependently decrease the ALT, AST elevation, and very close to our reference drug, liraglutide. And next, we performed RNA sequencing analysis on the liver from mice treated with halofuginone. And you can appreciate that many MASH-associated hallmark gene signatures associated with hepatic steatosis, fibrosis, and inflammation are all attenuated by halofuginone treatment. Since our previous data in the diet-induced obesity model as well as in the high-fat, high-fructose diet mouse model, we find halofuginone can lower body weight. So we want to know whether our anti-MASH effect halofuginone are totally dependent on the body weight loss. So next we switch to an animal model of MASH, which does not have the obesity or weight gain. And in this CDA diet model, we find that halofuginone treatment doesn't affect the body weight change. However, when you look at the histology, we find that in terms of areal staining of the hepatic lipid accumulation, we find that the lipid accumulation, hepatic steatosis, and fibrosis are all attenuated by halofuginone in this long obese MASH animal model. And we also analyzed some gene expression associated with the MASH fibrosis, including TGF-beta1, PTH receptor beta, TMP1, and collagen-1, and all the genes associated with fibrosis are attenuated by halofuginone, in particular the high dose. Since obesity is also a risk factor for the atherosclerotic cardiovascular disease, so next we approached whether halofuginone can attenuate atherosclerosis in the preclinical animal models. So we first established atherosclerosis by treating apognathoid mice with high cholesterol diet for 6 weeks, and then treated with halofuginone concurrent with high cholesterol diet feeding. And in this model, we find that the elevated FGF21 secretion level, as well as the plaque formation was dose-dependently attenuated by halofuginone treatments. And then we use the second animal model of atherosclerosis, which is LDL receptor knockout mice. And we also using the treatment regimen, and we established the plaque formation after 6 weeks of high cholesterol diet feeding and treatment with halofuginone. And similar data were found in the LDL receptor knockout mice. Next, since the previous we used mice model, however, the mice model have the different lipid profile compared with human beings. So next, by collaborating with Dr. Xunde Xian from Peking University, so we tested the efficacy of the halofuginone in the LDL receptor knockout golden hamster. And in this animal model, we find that the serum TG level, TC level, as well as plaque areas in the unfazed aorta as well as aortic sinus was attenuated. And this is also can be seen in hepatic lipid accumulation revealed by narrow red staining. So to summarize, our data lends convincing support to the activation of the GCN2 YAT2 alpha 84 pathway by halofuginone, which constitute to the elevation of the GT15 adjutant-1, which can suppress food intake as well as increase energy expenditure, contribute to its anti-obesity effects, as well as its potential anti-atherosclerotic and the anti-MASH effects. Now, currently we are exploring the role of EIPIS-1 integrated stress response independent effect of halofuginone in obesity, MASH, and atherosclerosis. And also we are working on the target identification of halofuginone by using 2 different methods. We identify one potential new binding protein of halofuginone, which represents potential new therapeutic target for treating obesity and associated cardiovascular metabolic disorders. And we're also working on the chemical modification of halofuginone, trying to reduce its vomiting, nausea, side effects, as well as maintaining its anti-obesity and cardiometabolic effects. So with that, I'd like to thank the students involved in this project who has made tremendous efforts to make it happen. And I also would like to thank our collaborators, including Professor Jianping Wong from our institution, and John Speakman, and Dr. Yu Huang and Amy Xu from Hong Kong, and many excellent collaborators in terms of their cardiovascular and metabolic medicine. And finally, the funding agencies were gratefully acknowledged. Thank you very much. I'm happy to take your questions.